Welcome back to ESCMID Television. I'm Michael Jackson, your host, and joining us now in our studio is Professor Roy Chemaly, who's traveled into Congress this year from Houston in the USA. Professor, lovely to have you with us. You're involved in both a symposium and presenting a paper here at the Congress. Let's talk symposium first. What's your involvement in that?
Yeah, first, thank you for having me here. I'm glad to be at this meeting at ESCMID. So we're presenting a symposium on cytomegalovirus, which is a main infection that can occur after stem cell transplant as well as solid organ transplant. And it's an exciting time for us actually because there is many antiviral into development in the late phase of development to prevent this infection actually. And I'm presenting data on safety of a specific compound which is letermovir, which I've been involved in phase 2 and phase 3 trial. So we're presenting some safety data and efficacy data in a large cohort of stem cell transplant recipients who are at risk for this infection, been recipient positive and got prophylaxis with letermovir versus placebo. And also we're talking in the symposium about the risk factor for CMV reactivation and CMV disease. We're showing mechanism of actions of different antiviral drug, either already commercially available or the one in development for the treatment of or prevention of CMV infection. We're talking also about T-cell response before and after CMV reactivation in stem cell transplant recipient, looking at CMV specific T-cell response by using ELISpot assay, what we call the T-spot assay, and see if this could be a significant or helpful tool for us to follow patient after transplant and see can we predict CMV reactivation or even protection against CMV reactivation based on the response on this T-spot response or the ELISpot response for CMV specific T-cell, looking at gamma interferon.
And a lot of interest in cryptomegalovirus here at ESCMID this year as well.
Yeah, absolutely. And as I mentioned earlier, this virus is very common after transplant. It can cause severe morbidity and mortality.
Of course.
For years and years, we tried to have a good strategy to control it. So far, it's working, but not the way we really want it. We still have an association with high mortality if patient gets CMV disease or CMV reactivation. So we're hopeful that hopefully in the near future, with the new antiviral that's going to come to the market, that it may change the landscape of CMV and hopefully the shift in the paradigm of prevention of CMV infection after stem cell transplant. And
Professor, the key walkaway that you're expecting the audience to leave your presentation with here from Congress, what would you say that was, sir?
So we're moving forward of preventing and decreasing hopefully morbidity and mortality from CMV. This happened over the past few years only. As I mentioned, for more than 20 years, we know it's a big problem and we try to mitigate this problem. But now we may have extra tools to work with and extra tool for management of this infection after transplant. So hopefully the audience will stay tuned for the near future where they're going to hear more exciting results about the new phase 3 trial that we just completed.
Fantastic. And just asking you the question, sir, from an American perspective, how important is an ESCMID Congress to you and your colleagues?
Actually, it's becoming more and more important and significant for us to travel and to try to attend on a yearly basis. Is a big setting and program now where you have involvement from experts from all of the part of the world, not only from Europe and not only from the US, it's actually from all over the world.
We have 125 countries represented.
Absolutely. And the diversity of the program and the topics, it makes it very important for us to make the trip actually on a yearly basis.
Thank you, and a pleasure to have you here in the studio with us, as well as presenting and at the symposium. Professor, thank you very much indeed.
Pleasure is mine, thank you.
A real pleasure, sir.